Amaqembu aphikisayo athukuthele agane unwabu njengoba efuna kuqashwe zonke izisebenzi zezempilo ezihleli emakhaya ukuze isize emizamweni yokunqanda ukubhebhetheka kwegciwane icorona.
Given the surge of the second wave across the country and in the Free State, we would welcome any additional capacity to assist where required in the province. The DA wants to see all our unemployed doctors, nurses and health workers who are able and willing to assist in the pandemic to be able to do so.
Those who studied abroad, they cannot be used in the government because those institutions that were studying are not accredited to the South African authority. So that's the problem. And another issue is saying, let them invite all those nurses that are at home, those doctors that are qualified to be assistant.
Kubikwa ukuthi izikhungo zezempilo kulesifundazwe zingaphansi kwencindezi ngenxa yesibalo seziguli eziphethwe iCovid-19.
Our hospitals are gradually getting full and nurses are also getting exhausted and sick. And this exacerbates the challenge of shortage of nurses that we have been calling for to be addressed.
Kuhulumeni uthi wenza konke okusemandleni ukuqasha zonke izisebenzi zezempilo ezingasebenzi.
The Free State Department of Health has been working hard since the beginning of this year to make sure that all health workers in all different categories, doctors, nurses, and everyone else who is able to register with the Health Professions Council of South Africa is able to get their space in the health facilities in the Free State.
Njengamanje bangaphezulu kweinkulungwane eyingama-67 abantu asebetheleleke ngeCovid-19 eFree State kwashona abangaphezulu kweinkulungwane 2,300.